Greetings, I Prevent followers. Did you know that July 28th is World Hepatitis Day? In observance, this month's YouTube video is all about hepatitis C. So what is Hep C? Hepatitis C, also known as HCV or Hep C, is a blood-borne viral infection that can cause liver damage as well as inflammation. This virus can range in severity from a mild to severe illness. In fact, for more than half of the people who become infected with Hep C, it develops into a more long-term chronic infection. As for the remainder, about half of people with Hep C don't even know that they have it, as symptoms can take decades to appear. While you might consider those people lucky, those with untreated and undiagnosed Hep C are subject to liver damage, cirrhosis, which is scarring of the liver, cancer, and in some cases, even death. Chronic and acute Hep C. Hepatitis C can present as either a chronic or acute infection. Chronic hepatitis C is known by many as a silent infection due to its frequent lack of symptoms. Often those with chronic Hep C may not experience any symptoms until the virus has already done significant damage to the liver, which can take years. Some of the symptoms of chronic Hep C include bleeding and bruising easily, fatigue, itchy skin, weight loss, and even confusion, drowsiness, and slurred speech. Every chronic hepatitis C infection begins with an acute phase, which appears 1 to 3 months after exposure and typically lasts between 2 weeks to 3 months. During this period, while there are few symptoms, some may experience jaundice, fatigue, fever, and muscle aches. Acute hepatitis C infection doesn't always become chronic. Some people clear Hep C from their bodies after the acute phase, an outcome known as spontaneous viral clearance. In studies of people diagnosed with acute Hep C, rates of spontaneous viral clearance have varied from 15 to 25%. Acute hepatitis C also responds well to antiviral therapy. Causes and risk factors. Hepatitis C is spread through blood exposure. Specifically, blood that contains Hep C would have to enter the bloodstream of an uninfected person. There are 67 distinct forms or genotypes of the virus, but the most common in the United States is referred to as type 1. There are a number of populations who are more at risk for contracting Hep C. They include healthcare workers, individuals who inject or inhale drugs and other substances, people who have received tattoos or piercings with unsterilized equipment, those living with HIV, and those who are currently or formerly incarcerated. Treatment. While there is currently no vaccine for hepatitis C, I am happy to report that simple and accessible treatment is available. According to the CDC, over 90% of people infected with hepatitis C virus can be cured of their infection, regardless of Hep C genotype, with 8 to 12 weeks of oral therapy. Remember that those who have been treated can become reinfected with the virus if another exposure occurs, so it's important to maintain Hep C prevention practices, even if you've already received treatment. Prevention. So what can you do to protect yourself and minimize your risk of Hep C exposure? For healthcare workers, avoid occupational exposure to blood by adhering to the guidance from the National Institute for Occupational Safety and Health and the CDC. Some standard protocol include using PPE, such as gloves, masks, and protective eyewear. People who inject drugs can reduce their risk by only using sterile syringes and never sharing with others. If you or a person you care for needs access to sterile syringes, I Prevent is here to help. Our team can facilitate sterile syringe and Narcan access at no charge to you. Call or text our outreach number at 504-418-4955 to arrange a free pickup. Individuals who frequent tattoo and piercing shops should be sure to choose a reputable shop. Don't hesitate to ask questions beforehand about how their equipment is cleaned, and always make sure the employees use sterile needles. Remember, a reputable shop will never mind sharing these practices with you. Lastly, if you or a loved one would like a free Hep C screening, we've got you covered for that too. Our prevention team conducts free community rapid tests at the Odyssey House Community Wellness Clinic Monday through Friday from 8:30 a.m. to 11 a.m. at 2700 South Broad Street in New Orleans. Need a different testing time? Just give us a call at 504-418-4955. That's it for now, I Prevent followers. Thanks for tuning in, and remember to like, follow, and subscribe for more I Prevent content.